Hello friends, today we shall learn on concept, need, importance and role of health education in family. Firstly, coming on to a very brief introduction. With a population of 12-10 million as per the census 2011, India is the second most populous country in the world, next only to China, whereas 7 in land area. With only 2.4% of the world's land area, India is supporting as much as 16.87% of the world's population. India's population has been increasing steadily since 1921. So, the year 1921 is known as the year of Big Divide. Why? Because the absolute number added to the population during each decade has been on the increase since then. And it will be alarming to know that the country's population is currently increasing at the rate of 16 million each year. While the global population has increased only 3 times, India has increased its population as much as 5 times during the last century. And it has been estimated that with the current trends, the population in India will increase from just 12-10 million to 1400 million, which is an increase in 13.5% and is expected to exceed that of China before 2030 to become the most populous country in the world. Then, recognizing that key factors in fertility decline include change in government attitude towards growth, the spread of education, increased availability of contraception, and the extension of services offered through family planning program, as well as the marked chances in the marriage pattern, India has launched the family planning in 1952. And it would be worthwhile to know that India is the first country to launch such programs emphasizing fertility regulation for reducing birth rates to the extent necessary to stabilize the population at a level consistent with the socio-economic development as well as environmental protection. The role of family planning is also being recognized by national policies and the country's 5-year plan too. Thus, as per the current 12th 5-year plan and the very popular National Population Policy known as NPP, formed at 2000, the program is currently being repositioned to not only achieve population stabilization but also to promote reproductive health and reduce maternal, infant and child mortality as well as morbidity. We are all aware that the National Health Mission, which is the flagship program of Ministry of Health and Family Welfare, envisages towards providing accessible, affordable, accountable, effective and reliable primary health care. And it provides a policy framework for advancing goals and prioritizing strategies to meet the reproductive and child health needs of the people of India, and very importantly to achieve replacement level of total fertility rate known as TFR of 2.1 by the year of 2017, coinciding with the 12th plan goal. What is TFR? TFR represents the average number of children a woman would have if she has to pass through her reproductive years bearing children at the same rates as the women now in each age group. Now, coming on to definition. So, what is family planning? WHO defines family planning as a way of thinking and living that is adopted voluntarily upon the basis of knowledge, attitude and responsible decisions by individuals and couples in order to promote the health and welfare of family groups and thus contribute to the social development of a country. Next, another WHO committee describes it as the practices that help individuals or couples to attain certain objectives, which can be named as A. to avoid unwanted births, B. to bring about wanted births, C. to regulate the intervals between pregnancy, D. to control the time at which birth occurs in relation to the ages of the parent, and lastly but not the least, to determine the number of children in a family. Next, the United Nations Conference on Human Rights held at 1968 has recognized family planning as a basic human right. During the past few decades, family planning has emerged from whispers in private quarters to the focus of international concern as a basic human right and a component of family health and social welfare. Coming on to the scope of family planning services, family planning is not synonymous with birth control. It is much more than mere birth control. The WHO expert committee has stated that family planning includes the following. First, proper spacing and limitations of birth. Second, advice on sterility. Thirdly, education for parenthood. Fourthly, sex education. Then fifth, screening for pathological conditions related to reproductive system. Then genetic counseling. Then premarital consultation and examination. Then carrying out pregnancy tests. Then marriage counseling. Then preparation of couples for the first child. Providing services for unmarried mothers. And teaching home economics and nutrition, as well as providing adoption services. These activities may vary from country to country, and India has also adopted their own sets of objectives and policies in this regard. Next, coming on to the benefits of family planning. The major benefits of family planning can be described as under: A. Stabilizes population, B. Reduces maternal mortality, and C. Reduces infant and child mortality. Though the principal outcome of family planning caters towards health aspect of women, fetal, infant and child health, it overall stabilizes as well as slower the rate of population growth, benefiting all aspects of development as education, health, agriculture, environment, urbanization, economy, as well as poverty alleviation. Next, coming on to a very important concept known as the family welfare concept. Family planning is associated with numerous misconceptions. One of them is its strong association with the minds of people with sterilization. Other equates it with birth control. The recognition of its welfare concept came after its inception when it was named Family Welfare Program. The concept of welfare is very comprehensive and is basically related to the quality of life. Thus, it aims at achieving a higher end, that is to improve the quality of life of the people. Coming on to small family norm. Small differences in the family size will make big differences in the birth rate. The difference of only one child per family over a decade will have tremendous impact on the population growth. Thus, the objective of Family Welfare Program in India is that the people should adopt the small family norm to stabilize the country's population by the end of 2045. Symbolized by the inverted popular red triangle, the program initially adopted the model of 3-children family. But in view of seriousness of the situations, since 1980s, the campaign has been advocated to only 2 children no. The current emphasis is on 3 themes. Firstly, sons or daughter, 2 will do. Second is second child after 3 years. And thirdly, but not the least, the universal immunization. Let me talk briefly on what is universal immunization. The Universal Immunization Program is a program launched by Government of India with an objective to reduce mortality and morbidity resulting from vaccine preventable diseases. It focuses both on immunization of children as well as pregnant women. A significant achievement of the family welfare program in India has been the decline in the fertility rate. All efforts are being made to reduce the total fertility rate, popularly known as TFR, to 2.1 by 2017. The current TFR is 2.5 as per the recent survey conducted by Government of India. Now coming on to the goals and objectives of India. The National Population Policy known as NPP frame at 2000 has advocated a holistic multi-sectoral approach towards population stabilization. In accordance to this, as well as a 12 5-year plan, specific interventions have been laid down through National Health Mission, which was previously known as National Rural Health Mission, has formulated the following objectives as under: 1. Address the unmet needs of contraception, reproductive and child health care. Secondly, achieve replacement rate fertility by 2010, and it has been put back to 2021. Thirdly, bring about population stabilization by 2045, which has been put back to 2026. Further, specific targets in regard to family planning has been set as under: A. Reduce the unmet needs for family planning methods among eligible couples, married and unmarried both, at an annual rate of 8.8% from the baseline of 21%. B. Increase met needs for modern family planning methods among eligible couples at an annual rate of 4.5% from the baseline of as high as 47%. The baseline data has been adopted from the survey data conducted by the Government of India. Now, coming on to a situational analysis. Though India has not achieved the desired rate, but the decline rate has accelerated since the implementation of National Rural Health Mission in 2005. Currently, 21 states have already achieved the replacement level of fertility or less, while 7 more states are on the verge of achieving replacement level of fertility. But concern still remains with 7 high-focus states which have a TFR of as high as 3 or more, as these are also the states with the highest burden of maternal and child mortality. The Government of India has set up a goal of reducing TFR to 2.1 by the year 2025. Some of the states have already achieved the goal, including our very own state Manipur, which has a TFR of as low as 1.6. Coming on to Government of India programmatic interventions. Like other countries, India has also set certain interventions for strategic delivery of the program, which can be as under: A. Servicing the unmet needs based on the felt needs of the community. B. A target-free approach. C. Children by choice and not by chance. D. basket of contraceptive choices, thus giving equal emphasis on all kind of contraception. E. Increasing the acceptance of contraception through community participation as well as advocacy by local community workers like accredited social health activists, popularly known as the ASHA and Anganwadi workers. F. Provision of Family Planning Indemnity Scheme, previously known as the Family Planning Insurance Scheme. G. Promoting public-private partnership known as PPP. H. Ensuring quality services through various interventions by the stakeholders at all levels of health facilities. I. Observation of World Population Day on July 11th of every year with a specific theme. Health melas, family planning, counseling as well as camps are being conducted to promote and propagate the same. This year, all the states in the country have observed the World Population Day with the theme Vulnerable Populations in Emergencies as of year 2015. Now, coming on to very important topic, that is translating policies into action. In order to translate the policies into specific actions, we may divide into three themes as under 1. Strategic efforts, which may be divided as under A. Community needs assessment approach and exercising demand generation through the same. B. Strategic and scientific planning of felt unmet needs at all the levels. Secondly, expand basket of methods, which can be described as under A. Improve contraceptive choices to all the eligible couples. B. Enhance the use of birth spacing and educate the need of the same to the target population. C. Capitalize on best practices, which can be described as under A. Scaling up effective innovations. B. Promoting sharing of best practices and scaling up the same. Now, coming on to importance and role of health education in family. The importance of health education regarding family planning should be re-emphasized, as it directly and as well as indirectly brings about a healthy nation through healthy mother and healthy child. The various programs under Government of India through facility-based as well as community-based education and outreach program seeks to ensure that all the communities are equipped with valid knowledge of the various services of the family planning program. It also envisages that they have access to preventive health services and education at all the levels. Now, let us conclude our topic. Thus, family planning program is a very important program to promote and propagate population stabilization. It has come a long way and holds forth the promise that in the not very distant future, it may be accepted as a way of life by most of the people. Although birth control continues to occupy the same important position in the program as it used to be in the earlier days, the program now aims at achieving a higher end, and that is to improve in conjunction with other development programs the quality of life of people as a whole. Thank you.